Hello, 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 everyone, and welcome to another edition of Ask NP Deidre. Nurse Practitioner Deidre is out of Ohio, and her YouTube channel is at NP Deidre. So make sure you like and subscribe to that channel. Also, like and subscribe to channel if you like our content. Ours is at The Way to My Heart. And we are doing business as the Global PAD Association, helping to prevent and manage a disease more prevalent and deadlier than most cancers combined, known as peripheral artery disease or poor circulation in your legs. Now, if you have tuned in before, you know that we always talk about walking as the best medicine. Walking is like your construction crew to build those collateral vessels or those natural bypasses in your body when you have blockages in your legs. And these little detours can reroute blood flow around the severe narrowing in your arteries and those blockages. But while walking is like the construction crew, I would say that what you eat, the foods and the drinks that you consume, they're like the building materials. And that's where we're bringing in Nurse Practitioner Deidre to talk about those items that can also help make your arteries more robust and help the blood cells get through some of those narrowed areas more efficiently and effectively to reduce those awful and debilitating claudication symptoms or the cramping that you feel in your legs due to the poor circulation. Today, this is going to be part of a educational series where we are going to be focusing on these types of foods. Today, we're going to be focusing on just one. We're going to be focusing on nitric oxide because I'm sure you've read a lot about it on the internet. Maybe you have, maybe you haven't, but this is an important one to learn about today. Welcome, Nurse Practitioner Deidre. Thank you so much for joining us. And I'm really excited to learn more about the benefits, well, pros and cons of nitric oxide.
Yeah, of course. Thank you. So it's something that we've talked a little bit about before, and so many benefits to nitric oxide because it's a natural molecule in our body and it helps widen the blood vessels. So you've heard of the term vasodilation before. But when we vasodilate, we improve blood flow. So for somebody with claudication, PAD, we really want to improve that blood flow. And so people, you know, with those symptoms of leg pain and such, boosting nitric oxide can really be a game changer, right? It helps to relax and open those arteries, right? And so more blood reaches your legs. It helps to reduce inflammation, so less arterial damage and stiffness in the arteries. It can help prevent clot formation, so lower risk of blockages to the extremities, and it can improve your exercise endurance. So it helps muscles get the oxygen they need.
Now, this is something that occurs naturally inside your body.
It is, yes.
And so, do we know what depletes nitric oxide in our body, or is that just part of the aging process?
It is part of the aging process, yes. So
And so, are there best practices in terms of replenishing your body with this nitric oxide?
So really, we look at like food as medicine, right? We want to essentially boost nitric oxide naturally, and that's through eating foods that are rich in nitric oxide. So those nitrate-rich foods, such as beet juice, is a great option. Your leafy greens, spinach, arugula, kale, celeries, radishes, those are great foods to start with that really help promote nitric oxide naturally.
And so when you talk about beet juice, is that the same as consuming beetroot powder? I use that a lot in my smoothies.
Yeah, so similar to that. Yeah, same thing because beetroot powder, right, helps circulation. It boosts nitric oxide for kind of better blood flow. And it's one of our beets are kind of one of the richest sources of dietary nitrates, right? Your body converts the nitric oxide from the beets there and acts as a vasodilator.
And can you just be more specific? What does it mean to be a vasodilator? My understanding is just as with ginger, or just as with, there is a formal medication known as cilostazol or Platol, which is part of the 2024 PAD management guidelines here in the US, which doctors describe as making the blood cells a little bit more flexible to get through some of those narrowed areas.
Right. So a vasodilator is relaxing and kind of widening the vessels to help improve the
Okay.
circulation to the legs. So
Oh,
if you think of when it dilates, it kind of opens a little.
opens.
Yeah.
Okay. And so does exercise affect our nitric oxide levels? And if we are doing more walking, which we should, uh, does that increase the amount that we need to intake versus if we're not exercising at all?
Right. So we want to be exercising because it doesn't do us any good to like vasodilate and not act on what we're doing, right? So if we want to be utilizing the medications and the beetroot powder and things like that to help our circulation, we really want to use that with your walking and the exercise too, because that is when we're going to build those good collaterals and help to get blood flow to those extremities. And so we're just optimizing the walking and the beetroot juices and medications so that we can build those collaterals.
Are there any supplements that can also increase nitric oxide production, or to supplement the body with nitric oxide? I would imagine those are two different things.
So you can supplement with nitric oxide, like they have supplements that are oxide supplements that many people use.
Are there any ones that you think are more effective than some of the others? I know with my dad that he told me he was taking some nitric oxide, and that there were times that it would, some of them would work and some of them wouldn't. And that would be my follow-up question. How do you know if a supplement with nitric oxide is working, or if you're consuming enough foods
So
to build that nitric oxide?
yeah, and so when we look at supplementation, I always say look at basically brands that have done studies, right? If they've done some studies on them and they've done some third-party testing and things like that, if they can produce a study that helps support what it's saying, that's what I look for when I'm looking for a good brand. I also look for the ingredients in it and the fillers and things like that. So that's some place to start, is just making sure that you have a good product that actually has been studied. It's not always that more expensive means that it's better, but the studies really to support it. And then the foods, I mean, there's so many great foods that boost it naturally. So we have the pomegranate, dark chocolate is another outside
Oh,
of the,
I like, wait, whoa, let's go back to dark chocolate. Wait, what?
yeah.
I like the sound of that. And I
Right.
can see a few smiles in our live studio audience as well. I think you hit the button on that one.
Yeah, I think dark chocolate, because it's a flavonoid rich food, we like the flavor of it, but if we add that with some berries and pomegranate, we're getting that rich nitric oxide boosting food as well. Green tea is another good one. So maybe a little cup of green tea after 2 o'clock with some dark chocolate and berries could be a little snack for somebody. And then walking and strength training to stimulate that nitric oxide production naturally. So keep walking with this constantly, like even a few feet at a time.
I love our live studio audience here. You have Joshua. Hey, talk to me. He's loving the sound of that dark chocolate. But Leslie is also, oh, before we get to Leslie's, Beth is asking, why not milk chocolate? Why just dark chocolate?
So you want 80% cacao. When you get into milk chocolate, you're not getting the flavonoids that you would because it's milk based. There's more milk in it. So the benefits of
It's
chocolate
almost like
usually
it's
come.
watered down.
Yeah, the benefits come from the dark chocolates.
And Leslie, I don't know if you want to jump on and ask your question, but she has a question about beets and eating beets. Is it as good as drinking beets?
I
Beet
would say
juice or
yes.
beetroot powder?
Right. And so powder's more concentrated, the beetroot powders or the juicing, but when you eat the beet itself, you're getting the fiber from it also. So fiber is really important for our diet. So um, the when we get into the beetroot powders, you're getting into something that's a higher concentration and they make it very concentrated. So you are getting more of the nitric oxide benefit from that. But eating beets will do that too. So we can add it into our diet and then we're getting the fiber and everything too. So incorporating the foods in our daily diet instead of always just supplementing it is always a good idea.
I'm still loving that we're continuing to get more messages about the dark chocolate. Kathy, who's watching on Facebook, you had me at dark chocolate. I think you had all of us. Can we just do a whole show on the benefits of dark chocolate and how to choose the right dark chocolate for your presentation of disease?
That's that would be fantastic, wouldn't it? I would just
I think so, but we usually have one of our studio audience members, Heinz, who will come in and remind us that there are certain heavy metals or metals that are in certain chocolates, and you have to be very careful and not consume too much, and because it increases your exposure to these other, I don't know if they're metals or something else.
yeah. Can be heavy
So there
metals
are
from the ground.
some drawbacks.
Yeah.
Yeah. So that's like maybe we'll address that in a whole other one, but everything in moderation. But dark chocolate, as you said, it's really good. You probably, if you are diabetic, watching your sugar, you do want to try to find there are newer brands of chocolates that are using alternative methods of sweetening the chocolate. And so you might want to check some of those out. My favorite is Hu chocolate, and that's a fantastic one that is low glycemic. So just a little suggestion. I actually make homemade Reese's peanut butter cups using that and natural peanut butter. So a little tip. Okay. So how do you measure nitric oxide levels? How do you know if you are not getting enough or you're getting the right amount, or worst case scenario, you're getting too much?
That's a good question here. Really, so to measure nitric oxide, it can be a little tricky, right? There's a couple methods that do exist. Nitric oxide and a breath test can be one. You can look at your nitrate and nitrite levels in the blood. That can be another way, looking at kind of the byproducts that form nitric oxide and react to oxygen in the body. That's a way to look at as well, or even nitric oxide in your urine. I will say it's not something that we see, you know, tested a lot. It's not something that's tested all the time. But when we look at somebody who has microvascular, like trouble with blood flow, always looking at like Dopplers to see if there's an improvement in the blood flow and the dilation and everything. That can be used, to assess your nitric oxide effects in a clinical setting. So that might be another way too.
Are the pH strips that you can buy over the counter something that you can trust the accuracy? I mean, it's not clinical, but maybe it can give you some sort of idea as to where you're at.
Yeah, to
You
look at
place these strips
nitrate.
right on your tongue.
Yeah, you can look at the nitric oxide levels there with those strips as well. And I've actually had some companies, Designs for Health is one of them, a supplement company I use, and they have those to kind of test for people to know what dosing they would want. And I found it to be pretty, impactful when we're working with a patient that has claudication issues.
Are there any contraindications for using, I would imagine not necessarily for the foods necessarily, but if you're supplementing nitric oxide, are there any contraindications for supplementing
Well,
that?
sometimes, we always say there's always risk benefits to everything. Getting it through your food source is good, but because nitric oxide helps to dilate the blood vessel and it can lower your blood pressure, you could have hypotension, like low blood pressure because of it. That could be something, that causes dizziness or so anybody who is on an antihypertensive medication or who is prone to low blood pressure, they may want to watch using nitric oxide supplementation or even really have that conversation with their provider. Somebody with increased bleeding risk would be somebody else because nitric oxide can reduce the platelet aggregation and thin the blood slightly. Not like aspirin warfarin does, but if you combined it with aspirin warfarin, clopidogrel, you could boost that, you know, bleeding risk. So anybody on an anticoagulant or antiplatelet would definitely want to be somebody who uses it with caution as well. The L-arginine in nitric oxide can cause some GI upset. So if you're really sensitive in the GI area, you could get a little bit of diarrhea, nausea, or stomach cramps, which goes with most medications too. But if you're somebody who's sensitive, maybe small doses, but really, there's not really a contraindication. Just looking at that, if somebody has kidney disease, also those high doses of arginine based nitric oxide boosters can strain the kidney function. So,
So we always, as we say in every single one of our episodes, you always need to make sure to check with your doctor before acting on any information that is provided here and get their explicit consent. What we try to do in each of these episodes is simply provide you with a little bit of education, some additional information that you may not find anywhere else to hopefully allow you to have a more productive and satisfying conversation with your healthcare team to create the ultimate care plan for you. So that's really important. And we're hoping that this information helps you. And I want to finish off here again, Nurse Practitioner Deidre, in talking about those foods and how much of these foods we should be consuming a day to make sure that we're getting enough nitric oxide to benefit our bodies and to help improve the blood flow in our bodies.
right. And so, I guess there's probably not a set hard rule of how much you need to be eating in your foods, but we know you need to be eating the rainbow. We know that you need to be adding 30 different colors of fruits and vegetables to your diet in a week. That doing things like that helps promote overall health. So when we're looking at that and we're like, many of those foods in the rainbow help boost nitric oxide. So if you're hitting the 30, chances are you're eating a nitrate rich diet as well. So you're going to be getting the colors from the leafy greens, the beets, the watermelon, the pumpkin seeds, the berries, the green tea, all of that, which can help stimulate nitric oxide in the body. And things
I
that
love coming in from, I just wanted to mention that we do have a comment coming in from YouTube,
okay.
and this person knows it's coming. Jerry says plants are not on his menu. Uh-oh. Any options for him? Dark chocolate? Green tea?
Yeah.
Walking more?
Walking, yeah, walking because it stimulates nitric oxide production. Maybe even some super greens. Talk to your provider about maybe supplementing with super greens or something that can help get those colors and vegetables and fruits in your diet. But I would, you know, want to say you want to avoid nitric oxide blockers if you're not eating that kind of diet, right? And nitric oxide blockers are your processed foods, your high sugar intake, and smoking. So those things can reduce nitric oxide levels. So if you're not eating 30 colors, vegetables, fruits in a week, you definitely don't want to be adding processed foods and high sugar and smoking to block what nitric oxide that you can produce through walking. And
Are there symptoms of low nitric oxide levels that we should be aware of? I would imagine they probably mimic a lot of the different ailments that are out there. It's probably pretty similar,
you're right. It's, I'm sure, similar for many, but
like
that can be,
cardiovascular issues, of course.
yeah, like your cold hands and feet, right? Low nitric oxide levels because of the blood vessels. If you have low nitric oxide, it constricts your blood vessels, right? And so you get poor circulation, especially in our extremities there. Fatigue, but I feel like that goes with almost everything. But because of reduced blood flow, fatigue and weakness, muscle
Yeah.
cramps, without enough nitric oxide, your muscles might struggle to kind of relax properly, and they stay constricted as well. And it also can cause
I would
some.
imagine depression and mood changes, impaired memory. I mean, all of those things kind of go along with that kind of thing, I would imagine. And you
Right,
mentioned earlier reduced exercise performance and endurance.
right. Reduce exercise performance, brain fog, right? Impaired mental clarity are a sign of poor circulation, which can be due to low nitric oxide. So, headaches
And
because of
just to end
narrowing
on
of the
a
blood vessel. Yeah,
high note, or should I say low note, erectile dysfunction.
yeah. I was going to say that. I was like, it's critical for vascular health. So it can,
But
that,
also sexual health.
yeah, that includes the blood vessels involved in erection. So low levels of nitric oxide can lead to difficulty maintaining erection or because there's not enough adequate blood flow.
Perfect. Well, thank you so much, Nurse Practitioner Deidre. Is there anything else you wanted to add? I think we did a pretty good exploration of nitric oxide as our first in our series on food and drink that hopefully will help improve claudication symptoms in those with peripheral artery disease or poor circulation in the legs.
No, I think that's a great
Yeah.
start. And then let's take the questions for the upcoming episodes for later.
Fantastic. So if you do have questions, make sure you comment here on this video. We're going to get to them next week. Are we doing same bat time, same bat channel?
Yes.
Okay, so we'll see you next week, next Wednesday. Check your time zone to make sure which time is right for you. If it's in Europe, if it's in New Zealand, if it's in Australia, Canada, any part of the US, just make sure you check your time zone and put your questions there in the comments, and we'll make sure to get to them next week. And we really appreciate you guys being here. If you want to get notified before, when I post the video link, make sure you like this video. Make sure you subscribe to our channels, especially youtube.com/the @NP Deidre. And you can also subscribe to the Global PAD Association's channel at youtube.com/the way to my heart. But thank you so much for being here, everyone. We really appreciate you. And we will see you.